The governor is also expanding COVID-19 testing in the state
because we don't have enough testing kits.
Many people are never able to get tested because of shortages of kits.
We don't have enough tests.
People are worried that right now they can't be tested because there's not enough tests to go around.
There simply aren't enough tests in the world, says UCLA lab director Oh My Garner, to meet demand.
These are scary times. By some estimates, up to 1/3 of the population may ultimately get this virus. The problem is the resources to treat these patients are limited. If we were able to determine how patients were going to react, we could devote those resources to the patients who are going to need them the most.
IES Life Sciences is a diagnostic company, and we have the ability to develop a test for COVID-19. With this test, we're going to be unique. Number of tests can tell you pre-symptomatic if you have the disease. A number of tests can tell you what your viral load is. We can do all those things. But the thing that we can do that nobody else has the ability is we can tell you your course of treatment. We can tell you you're going to be fine. You need to go home. You need to take care of yourself. You need to self-quarantine. We can also tell you you're going to need to go to the hospital and you're going to need to be monitored, but you should be fine. And the last thing we can tell you is you're going to need to go to the hospital and you're going to need to be put on a ventilator.
This is important for the patient, obviously, because about 20% of the patients have severe disease, and current estimations for death rate is about 1 to 3%. We want to reduce that. We want to eliminate that. At the same time, the healthcare system is being extremely taxed because of the limitations in the ICU room, mechanical ventilators, and the stress on the healthcare operators themselves, the hospitals, the nurses, the physicians. So if we can more effectively treat those individuals and they get out sooner, we'll have less stress on that system.
Our diagnostic test has the ability to determine which patients have healthy, strong enough immune systems to defeat the virus on their own, and which patients are likely to need additional monitoring, hospitalization, ventilators, and potentially pharmaceutical support.
If we are able to get this test to market, not only are we going to save millions of dollars in unnecessary treatment, but we're going to save lives.